Hi, Paul Auwaerter here with a blog on peanut butter and salmonella. Another hot food topic, unfortunately, where many people, over 486 now, have been sickened, and there have been some deaths that have been attributable to salmonella infection, specifically Salmonella serotype typhimurium. And a number of state health departments, as well as the Centers for Disease Control, has indicated that the main source of this appears to be the King Nut brand of institutional peanut butter that might be served in hospitals and nursing homes, as well as commercial peanut butter paste, and so that the consumer public might have been exposed to this through Keebler and Austin peanut butter cookies. In fact, on the FDA website, there's a whole brand of peanut butter products, I think over 125, that are now listed as potentially containing these products. And of course, there's been a recall of any potential products. I'm sure the list will grow, but it dates all the way back to the summer for assurance sake. It's not yet clear whether this outbreak is diminishing, although the number of reported cases do seem to be decreasing a bit. But it's worth making a couple of quick points about this. The first is, if people are concerned about ingesting some peanut butter product, it would be best to go to the FDA website and look and see if indeed this product is listed. Really, jar peanut butter is not involved, as far as I understand, from the FDA and reporting organizations so far. The second is, especially for the time being, until it's clear which products are affected, it would be best to avoid any peanut butter or peanut butter flavored product where this peanut paste might be involved. And this is especially true for the groups most at risk of severe salmonella infections, such as older people as well as people with suppressed immune systems. The second point would be that salmonella, if indeed ingested, could take anywhere from 12 hours to about 5 days to produce infection, most typically diarrhea, but you can see fever and abdominal pain, and occasionally can progress to sepsis. Typically, even if somebody is infected with salmonella, if they're not very ill, antibiotics are not called for, because it'd be best to have the organism expelled by the body without antibiotics, because of potential for side effects of antibiotics, as well as chronic carriage of salmonella. Now, of course, if someone is very ill, is dehydrated, or requires hospitalization, it would be prudent to give antibiotics even while awaiting identification of whether salmonella is implicated or not. And of course, salmonella and campylobacter both typically trade places as the most common bacterial foodborne pathogen. This even extends to pet foods. I had a patient who came in very worried that her pet had eaten peanut butter products. So this peanut butter paste is not only in many items for human consumption, but in pets as well. So the Centers for Disease Control is a very nice website that's kept up to date with frequent updates on the situation. And again, it would just be best to throw out any product that you might have that's on the FDA list, or refrain from eating any peanut butter products until the situation clears. I think certainly the public health organizations, both in states and the federal government, have responded very nicely to this with good information. Manufacturers issuing recalls, and of course, in our very large-scale oriented system, foodborne outbreaks unfortunately are a consequence. I think a number of organizations such as the FDA and others, the Department of Agriculture, are seeking to have a better way of monitoring some of this, but of course it does require more resources. But these continued outbreaks do beg the question of whether we can enhance our food safety in a better way. And as these outbreaks continue, I think there'll be more call to action, as there were with the hamburger outbreaks in the past. Thanks so much for listening, and have a good day.